Hi, welcome to Health Hub Live at St Vincent's Private Hospital. We're really happy that you're joining us today. My name is Stephen Foe. I'm a rehabilitation physician at St Vincent's Hospital and an associate professor at the University of New South Wales. And this is, together with me today, is Sean Munkhoven, who is head of allied health at St Vincent's Private, as well as an active physiotherapist and a clinician scientist, and also an associate professor. But today we're just going to be Sean and Steve. So thank you for coming. We're going to be talking a little bit about prehabilitation. So this is getting yourself ready at home prior to coming into hospital for an operation or a procedure that might require a prolonged stay in the hospital. And it's been shown that prehabilitation, getting yourself ready for these operations or procedures, actually decreases the number of complications, decreases the time spent in the hospital, and improves quality of life and the speed of recovery. A rehabilitation physician, just in case you're not aware, is a physician who specialises in using a multidisciplinary team. That's physios, occupational therapists, psychologists, dietitians, to help a person recover from a serious illness. Quite often we approach people in the same way as professional athletes are approached by sports coaches, and they'll have a sports psychologist and a sports dietitian and a trainer, and the whole group tries to get the athlete ready for their event. So we try and treat people in the same way as we might treat professional athletes. And whilst nobody wants to be in that position, if it ever does happen to you, there's a group of people and a specialty that will help you do that. So now back to that focus on prehabilitation, getting yourself ready for an operation. And I might ask Sean to talk about the role of exercise at home prior to, say, an orthopaedic procedure like a joint replacement, and what might be the focus of that training.
Yeah, look, Steve, traditionally we've had a model of care, or the way that we would treat patients was really centered around rehabilitation. So if the person would have an operation, they would have some sort of intervention, and there are some pretty predictable things that will happen after an operation in certain clinical groups. And we would react to those, and then we would manage them. So that's what traditionally we've done. But about 10 to 15 years ago, the whole concept of prehabilitation started to come into healthcare, where rather than having a very reactive model of care, where we would just respond to what was going on, we would predict what people were likely was going to occur, and then we would manage predictable problems. So basically, you would have systems in place already in your mind and physically to solve some of these fairly predictable problems.
Can you give us an example of that?
Yeah, there's a couple of pretty good examples. I think your athlete example is great, because I suppose if we ever said to an Olympic athlete, you're going to the Olympics, and they would rock up to the Olympic Village and they'd say, how's all this going to work? You'd say, you're mad, you haven't done your preparation. Mm-hmm. So you've got to prepare yourself physically and mentally coming into the main game, which is your operation. So my experience from a research point of view, and also clinically, is in the area of orthopaedics, urology, and cardiothoracic surgery. So a great example in urology is men who are undergoing prostatectomy. So that's
a prostate operation.
Yeah, total removal of the prostate for the management of prostate cancer, which is an operation, and St Vincent's Private is a centre of excellence in this area, along with others, and also, so men after prostatectomy, the vast majority of men, 80% of them, will get some form of urinary incontinence. 80%, so it's a fairly predictable problem.
So just a bit of trouble controlling their urine after the operation, which can be permanent or temporary, but mostly temporary.
Yeah, and the time it takes someone to get better, get their continence back, is really quite variable. So the main way we used to rehabilitate patients was to use pelvic floor muscle training. So the concept then became, why don't we do this before and get these muscles engaged when someone is fit, healthy, well and strong, and then get these muscles engaged, and you're then able to when it came to having a period of incontinence, you could hit the ground running and you had systems in place. Because pelvic floor muscle training, I have to say, is a fairly abstract concept for most men. And so, so being able to then initiate a program that you're already familiar with and put systems in place to solve predictable problems has been a real winner. So our research group has done a range of studies, including an important systematic review where we pull all the evidence together to show that if you do this at 3 months after this operation, you won't have as much leakage or incontinence after prostatectomy. So this is a big deal for a lot of men.
So just taking that into another area, such as orthopedic rehabilitation. Say you're about to come in for a knee replacement or a hip replacement. Prior to coming in, the idea would be to strengthen your other side, because the other side, the side that's not going to have the operation, is going to be depended on quite a lot. So you want the muscles to be strong and the joints to be in good condition. As well as that, you want the muscles in the leg that's going to be operated on ready to start the rehabilitation afterwards. And I put it to you as well that simple endurance training, which might come from just walking or swimming or doing hydrotherapy or just doing sit to stand exercises at home, prepares the body as a whole for the anaesthetic and also the recovery period. In a study that I think I've talked to you about, Sean, in Western Sydney and also in Victoria, they found that a period of 3 weeks of prehabilitation prior to joint reduction surgery resulted in people not having to be admitted to the hospital following the surgery, and they could actually undertake their rehabilitation as an outpatient or even at home. So
people, I think, are more confident in the things that they're being asked to do. So it's much easier to learn how to do crutch walking before an operation when your head's in the game, rather than just say after an operation when you've got say, for example, if you've had a knee replacement, a sore and swollen knee, and you might have, you're recovering for an operation. It's not a great time to learn new tricks. That's pretty.
I think the other thing is you also get a sense of your participation in your own recovery. Because sometimes after an operation, when we say to people, you've got to get up and start walking now, they're surprised that the operation didn't just work instantly. Well, nothing works instantly, and everything takes time, and all the best things take a bit of effort. So getting your mind into that prior is very good.
Certainly setting those realistic expectations. I think it's those patients who do present with those realistic expectations about what I'm required to do and when that's likely to happen. And that's and of course there's an aspect of this which is we all operate in a world of patient-centered care. So each patient is an individual. So oftentimes those milestones are set for the individual patients that we're asked to manage as part of Stephen's rehabilitation team.
There's other things, of course. For instance, diet and weight reduction. You can prepare for an operation by losing a little bit of weight or getting your diet into a sensible sort of pattern, so that you're snacking less and you're having regular meals and you're focusing on proteins and vegetables and fruit, and less on carbohydrates like chips and rice and things like that.
And just on that diet point of view, you can also then prepare for what's going to happen after you leave the hospital. So, for example, you can have a whole series of meals prepared in the fridge, ready to go, that are nutritious and will meet your needs. And so that can often be a barrier to people doing well after surgery is not having the right nutrition. But if that's all set up and ready to go, right through to getting a haircut, and also mowing the lawn, you're preparing yourself for what you know is likely to happen. So having these systems in place for these predictable things that we see time and time again after surgery, I think it is really very important.
One of the sort of therapists that work in our team with Sean and myself is an occupational therapist. And believe it or not, they're very valuable to think about prior to the surgery, because say, for instance, you're going to have back surgery or neck surgery and you've got multiple stairs at home. You might rethink how you would be able to live at your home without having to go up and down the stairs multiple times, to allow your body to recover for a little period before you hit the stairs. And occupational therapists can sometimes just look at photos of your house or have a phone call with you just to give you a few sort of practical ideas. So, if your favourite foods are in shelves that are high above your eye line and you're about to have a neck operation, it's no good because you're going to be constantly looking up and reaching up. So you'd be moving some of those things down. They're pretty straightforward, sensible ideas, but it doesn't occur to people all the time in preparation for surgery.
The telehealth has been really helpful, and also people's access to cameras on phones to be able to really give you some sort of panoramic view of what they're being discharged to. And the occupational therapy team are really clever. Like they are able to sort out all sorts of logistical problems if that's going to affect your recovery or prevent you, in fact, from going home in a timely fashion as well. Home visits are also a direct home visit, but with the technologies we have, it's been a much easier process.
The other area that occupational therapists can help you is preparing to return to driving. So if with some operations or some procedures, there's a period of time where you can't really drive. So making sure that you know how long that is so you can arrange transportation, and also working out, for instance, that if you're having an operation on your left leg and you have an automatic car, your ability to return to driving might be faster than if you had a manual car, and other little practical things like that. So the occupational therapist has a role as part of the team, and psychologically there is ways you can prepare for surgery or for admissions to hospital, because no matter who you are, coming into hospital is a stressful period. You lose a lot of your autonomy because things happen to you, and anyone who tells you it's a piece of cake is sort of having you on. It's always a bit stressful.
Yeah. The other important group I think that we see here is you've mentioned, like we've been talking about, urology, some orthopedics, and also some neurosurgery. I think cardiac surgery, it lends itself really for a good period of preparation before.
Mm-hmm.
And that can range, of course, from just understanding the pathway to getting better, but also then starting to look at some key muscle groups that we can strengthen to make it just easier getting in and out of a chair. That can be a game changer for some people after cardiac surgery, I reckon. And also we can even bring it down to those patients who are at higher risk, so those patients who may be frail, or those patients who in fact have some sort of lung pathology, so people who have emphysema or some sort of lung disease. There is an intervention called expiratory muscle training, which can be, incredibly helpful in these patients. And these often can be 5 or 6 percenters. But if you put 6 of these 5 percenters together, you're going to be 30% better. So it's not, you can't hang your hat on one of these interventions. But if you put them all together, the period of after an operation, but also the other thing I think that's important is that you can manage your anxiety before the operation by having some sort of locus of control. You can take charge of really being in control of where you're headed and what you're in for, and working really closely with the medical staff who are looking after you.
There's good evidence if you address if you sort of walk through the procedure in your mind, it addresses anxiety, but also it's quite interesting, it decreases the requirements for morphine after many operations, including cardiac surgery. So for those of you concerned about use of opiates, preparing psychologically for cardiac surgery, in this example, is a good idea. And there are a lot of other things to think about. Return to driving, return to sexual function after cardiac surgery. All of these things are things that are worth considering and often worth discussing with a counsellor or a clinical nurse or a psychologist. So Sean, how do people get prehabilitation?
Yeah, a lot of it is consultant driven. So the captain of the ship when it comes to having an operation really is your surgeon. Each surgeon has a particular pathway for the management of their patients and their clinical expectations. The urology service here, for example, I know runs a comprehensive workup for surgery program with a physiotherapist, Stuart Baptist, who's a world leader in this area. And certainly our experience providing those services as well. So a lot of these come from patients want to know that they're being sent to a member of the surgeon's team, and also they want to know exactly who they're going to see. So that's the research that we've done in this area. What enables people to get these services is basically a recommendation from the surgeon, and they need to know where to go to, being given a particular provider to go to, and having sort of some fairly some constraints about this, where a lot of these programs in the preparation are self-managed programs. So you're able to do it in your own time, in your own space, and it's kind of logistical. It works for you as an individual, and it works for you in your preparation, and also works for you in the time frame that you've got. Look, there are some operations, unfortunately, where you can't prehabilitate. You've just got to get in there and get the operation done. So,
I mean, trauma is a good example. If you fall a ladder and you break your leg, well, there's no prehab there.
Yeah, so yeah, absolutely. Maybe some balance exercises afterwards.
Afterwards, yes. Afterwards, you've got to work on not using the ladder.
Yeah. Yeah. So certainly the effects on how long you stay in hospital, I think, are quite important. And but again, having that sense of control both before and after.
I think the way that you can get prehab services is that you can speak about it to your surgeon or the pre-admission clinic. You can ask for referrals to rehabilitation physicians or to public outpatient services.
Just on that, Stephen, we do run a prehabilitation service here for the consultants who do request it. And again, some of that can be done as a face-to-face intervention, but because this hospital is a tertiary referral centre, so patients come from everywhere to have their operations here, we've got to have systems in place to be able to manage people both locally and from afar. And then all that information is captured and forms part of the plan for you coming into the hospital. So there are basically no surprises when you front up to have your operation. We know about you and you're ready to go. So yes, they are run through the Allied Health Department here, and it's a developing service. And again, it's a service that patients can actually do quite well.
I think it's important to think about these things. If you do have any questions, feel free to put them in the comment box down below. I think the last thing I just want to talk about is keeping yourself healthy in the event that you might need an admission on a medical basis. So, for instance, if you've got a lung disorder, maintaining the fitness, maintaining your endurance, also maintaining the strength of your upper body, keeping your diet under good control, and being able to manage any anxiety that might come about are really good things for you to keep doing on a general basis. Because, as you know, from time to time, people with chronic lung conditions do get admitted for pneumonia and other medical conditions. So the fitter you are, the less likely you are to have to stay for a long time, and also the more likely you are to return to your usual level of function. I think we've just about covered everything that we do.
Pretty good summary, I think,
We're quite happy to answer any questions now or in the future. If you do have any questions, go ahead. But otherwise, we might leave you to it for today. And thank you so much for joining us. We really hope these videos and this engagement with you assist you managing this difficult time with home isolation, but also helps you prepare in the future for any surgery or involvement with a public or private hospital here at St Vincent's. Thank you very much.
Thanks, Stephen.